Hey, this is Doc Eric. Welcome to my YouTube neighborhood, the channel where we give you one mindset tip and one body set tip as it typically pertains to something health related or fitness related. Today we're going to be talking about MRI diagnoses as they pertain to lower back pain. So let's go ahead and jump in. So in terms of being a chiropractor, we typically see lower back cases pretty often in my office. By the age of 40, 9 out of 10 individuals will have reported some sort of lower back pain as it pertains to physician visits. Lower back pain is typically a costly adventure. There's a lot of costs, high costs associated with surgeries, injections, medications, and things like that. So we see that it is a lucrative business for a lot of individuals in terms of getting people out of lower back pain. One of the ways to evaluate if somebody has lower back pain is to take either an X-ray or an MRI. X-rays typically are looking at the bones themselves, whereas MRI is a higher quality image, and it's going to give you a little bit more in-depth information in terms of soft tissue, which is where we can typically see disc herniations, disc bulges, and things like that. So out of the two, the X-ray is the initial imaging study, and the MRI is the upgraded imaging study that typically gives us a little bit more detail. So when people report lower back pain and they end up getting an MRI or an imaging study, we see a couple of interesting things. And there's been many different studies that all kind of do something similar, which is they take a population of individuals who are either symptomatic or asymptomatic, and they go and they have them do an MRI, and some of them come back with MRIs on the imaging studies, and some come back with none at all. And why this is interesting is because when we look at individuals who come in with some sort of a lower back pain pathology and they show us their MRI, sometimes we see larger disc bulges, sometimes we see small disc bulges, and sometimes we see nothing at all that pertains to the type of pain that they're in. So they're kind of left wondering where their pain came from because the MRI doesn't show anything. So one of the things that we look at when we're looking at individuals with lower back pain is we don't want you to think and be defined by the imaging study that you see. Another thing to consider is you can be asymptomatic and yet on an MRI you can show disc bulges, which is interesting because these are individuals that walk around with typically minimal to no lower back discomfort, but on paper, on an imaging study rather, they'll show a disc herniation. And then conversely, on the opposite end, you could have somebody that comes in with horrendous lower back pain and they get an X-ray or an MRI, and on the imaging study, especially on the MRI, we don't see any disc bulges at all, right? So it's one of those things where you don't want to be defined by the image that you see. So while imaging studies are important to add to somebody's patient records, we don't always live and die by what we see on an X-ray or what we see on an MRI. Typically, patients respond very well to conservative treatment, either through chiropractic care or through physical therapy care, as opposed to rushing in and getting injections or getting microsurgeries or things like that. So the take-home message today is that we shouldn't necessarily treat according to what the MRI shows, and we should always base patient care based upon the presenting symptoms as well as a thorough examination. Typically through conservative care, you're able to get the patient out of acute pain, get them out of symptomatic pain, and then through corrective exercises and strengthening, you're able to better help them heal themselves in future. So today's mindset tip and body set tip today is if you're somebody who's currently experiencing lower back pain and you've recently received an MRI or an X-ray and there are structural findings, always go over those findings with your provider. And obviously when you go and see your provider, have them do a full screen, movement screen, symptomatic screen, your pain presentations, things like that. And based upon what your provider sees, they will be able to better diagnose and better be able to provide a protocol that's going to help you heal better and do better. And until next time, stay healthy. So there you have it. We went over the talk of an imaging study, an X-ray versus an MRI, in terms of should you be defined by the type of pain that you see according to the imaging report? And the answer is no, but always remember to see your provider, go through a thorough evaluation, and they'll be able to take it from there. And until next time, stay healthy.